So today we're going to be talking about pelvic pain and pain with penetration. This is a big issue that affects approximately 75% of women at some point in their life, so important to cover. So today we'll go over a brief overview of some causes of pelvic pain. We'll talk about some resources for more education about this. We will discuss how to talk to your doctor and OBGYN about your pain, how to cope with your sexual pain in the meantime through your treatment plan, and how to maintain your intimacy and connection in your relationship while experiencing pelvic pain.
Okay, great. Thank you, Victoria. Okay, everybody, welcome to the Pleasure Program. My name is Holly.
And I'm Victoria.
I already introduced you, Victoria. We're two licensed therapists who specialize in sex therapy, here to answer your questions, share our knowledge and information with you all here on YouTube. So take a look at our disclaimer in the description box. And please note that we are here for education and entertainment purposes only, and this is not a substitute for individualized treatment, right?
Right.
Okay.
Okay, so like I had said earlier, this is a big issue. Right? 3 out of 4 women experience this at some point in their life where they're experiencing pain with penetration or pelvic pain, and 1 out of 7 women experience that chronically.
Wow.
Meaning this is lasting like over 6 months, and this is a big issue.
Oh my goodness. And it's a much bigger issue than I think a lot of people realize. And I'm sure there's reasons for that we'll probably get into as to like why we don't recognize this maybe as a bigger issue or people are not talking about it, but it certainly affects a lot of vulva owners, women. So it's an important topic that we really need to address and hopefully help people get more insight about, right? And on the path to recovery.
It's something that people who experience pelvic pain, there is usually a lot of shame and embarrassment that goes with that. And so it can be really hard for them to talk to their doctors about it. And hopefully in knowing that it's so prevalent of an issue, they know that they're not alone and they feel more empowered to speak up to their doctor or their OB about this because they're absolutely not alone in it.
Yeah, for sure.
And there is, like, in terms of, you said, why is this, something that maybe we don't even realize is an issue? There's a huge history actually where, and maybe in the last 20 or 30 years, it's become more well known. But prior to that, not even like 30 years ago, they used to basically label these women as crazy if they would come in and complain about pelvic pain and just say, go see a doctor. Or go see a therapist, you're crazy.
Yeah, I mean, I think historically women are often treated in a way that when there's a legitimate problem, a health concern, that you're hysterical, like hysteria, right, is a thing from history, and it's all in your head. And I think that is a misconception around vaginal pain, pain with penetration, that like it's all psychological, which sometimes there is a connection there, but there's plenty of other reasons why that could be happening, right?
Absolutely.
That we're gonna cover.
Yep. We'll get into the causes. Absolutely right. There is sometimes where there's a level of like anxiety or fear that will create a pain response, but that pain is also physical. Your muscles are having a reaction to that. So it's not all in your head. Right. So if you've been told it's all in your head, that's not accurate. And keep tuning in so we can talk more about the causes. So we'll get into that now. Let's get into some causes so people understand the vast amount of diagnoses that, could be an answer to their pelvic pain, right?
Okay.
Usually people only know about maybe vaginismus causing vaginal pain. So there's a lot more than that we'll get into. Well over 20 diagnoses relate to pelvic pain, but we're not going to cover all of the potential. We're just going to
be here all night.
We would take all night.
They're all valid. They're all valid, but
yes, absolutely. But we'll get into some general reasons why you might be experiencing pelvic pain, and maybe a few diagnoses that go along with that. So you can start to look into these areas to see if this might be why you're experiencing pelvic pain.
Okay.
Okay. So let's start with number one, which is hormones. This is a pretty common one with pelvic pain because there's a lot of things that can impact hormones. If you have a reduction of estrogen or testosterone or your hormone receptors, if there's an issue with those, there's an absence, you can be experiencing pelvic pain, probably in relation to a lack of lubrication. And some things that can affect your hormones could include your birth control, acne medications, infertility medications, giving birth. After birth, you have an estrogen dump. So giving birth, that's really common. About 50% of women in the first 3 months report pain. And again, that's just reporting, right?
Yeah.
We talked about shame, so not everyone might even be reporting that, but that's a big one. And then also like antidepressants, because those can affect lubrication, and treatments for different types of cancers. So there's a lot that could affect hormones that might be causing your pelvic pain.
And the change in hormones affects the level of lubrication that you're able to produce. So would the pain be related to too much friction happening and not? Okay. What about we're going to talk about the lining of the tissue, right? Because can hormones affect how thick or thin the lining is?
Yes. Yep. With hormones, you can have thinning of tissues, which can cause pain as well.
Which sounds like a tricky combination, right? Less lubrication, thinning of the tissue. That does sound painful.
Exactly. And along with that, another issue that could be happening is atrophy, like your thinning, and then that can happen because of endometriosis as well. You can have issues with tissues where tissue similar to the lining of the uterus is growing outside of the uterus as well. So there's lots of tissue issues, which can be hard to say, along with hormones.
Yeah.
And honestly, endometriosis is extremely painful. So we're not laughing at that. We're laughing at
tissue issues.
Silly word. Exactly.
Yeah.
Exactly. So next big cause that we'll get into, which we already touched on just a tiny bit, which is another big one that might be more well known, is some pelvic floor issues. So there's two things that could happen with your pelvic floor. They could either be the muscles, they could either be too tight, which would be hypertonic, or they could be too loose, hypotonic. And if they're too tight, that means they're in a constant contraction, and it can feel really painful to have things
touch something that's a very tight muscle, right? It's like you had a really tight muscle in another area of your body, or like a knot or something, and sometimes pushing on that can really hurt, right?
Right, exactly. So something in relation to that we touched upon is vaginismus. And vaginismus is when your pelvic floor, those muscles, spontaneously or involuntarily contract. And this can feel like you're like hitting a wall. This can feel like a burning sensation. This can happen, even with inserting a tampon or a finger. It doesn't have to be for full penetration. And so this might be where things come about, where people are saying it's all in your head, because this can be seen as a fear response. Like your body is fearful, your mind is fearful of that penetration, and so your muscles are just clenching as in protection, essentially.
Right, which makes sense. Our bodies do all kinds of wild and miraculous things in an effort to protect us, right?
Right, exactly. And then in the long run, actually might be harming us in some sort of way, right? Like causing pain.
Right. Well, it means well. It
means so well.
It does. It means well. We talk about this all the time in therapy with clients. Like our brains, tell us all kinds of interesting thoughts, beliefs, even bodily responses related to trauma in an effort to protect us. But it ends up backfiring sometimes, right? Like there's a downside to that reaction. So this would be a very obvious example of that.
Right, exactly. So with vaginismus, sometimes it is in relation to like anxiety or trauma.
Okay.
If you are someone who has experienced sexual trauma, I think it's really important that the first kind of work you do here, which is usually validated by OBGYNs as well, is trauma work. So you could go see a therapist certified in EMDR, which is a prominent trauma treatment right now, eye movement, desensitization, and reprocessing to work through that trauma and know you're not alone. About 1 in 5 women have experienced sexual violence. So,
yeah, which is just so sad and horrific of a number.
right,
But we can, through that style of therapy, kind of retrain our brain to have less of such an extreme anxious response, right? And kind of calm
right,
that reaction so that perhaps that guarding response, that fearful response your
right,
body's having is reduced.
right. You're working through and processing that trauma first. And then you might work with like a pelvic floor specialist or physical therapist to help you work also with your body in the muscular contraction as well.
Okay.
Even if you don't have vaginismus fully and you just have too tight of pelvic floor muscles, you'll want to see a pelvic floor physical therapist as well. Yeah.
Okay.
So that's pelvic floor muscles. That's a big one. I think that's a common one that comes along with that myth that it's all in your head because of the anxiety, right? Not true, because your body is actually having that response as well.
Right. Well, that mind-body connection. It's
Right. Exactly. Another thing that could be causing pelvic pain is inflammation. So inflammation can cause lesions on your skin, or you could be experiencing pelvic inflammatory disease. These things cause pain. Pelvic inflammatory disease can be caused by STIs too, like chlamydia or gonorrhea. So if you are experiencing one of those, that could be leading to inflammation or this disease and pain.
Could you have like an STI with this symptom and not realize it and need to go get tested?
Yeah, absolutely. Absolutely. And other STIs cause pain as well, such as HPV or herpes.
Okay.
HPV is extremely common, actually. And so it's good to get checked out just in case to see if that might be leading to some pain or to help try to prevent it from leading to any pelvic pain.
Interesting. I hadn't heard that related to HPV. Do we know what exactly it is about that particular virus that might cause pelvic
I'm
pain?
not sure.
Just that
I'm
there's
not
an
sure.
association?
Yeah.
Yeah.
Yep.
We should probably say we're not medical doctors, right? We are kind of giving this overview of what we have learned, right? Just some basic
Right.
knowledge around what are the different diagnoses that might be related.
Yeah.
But we kind
Yeah.
of come in a little bit later, right, to help people with coping with this particular
Right.
issue.
Right. This is just to provide some hope that you might have an answer to your pelvic pain, because there are so many different areas that could be causing this that like there is something. It's not all in your head. There is
Right.
probably something related. We just need to get you the right care and help you learn how to talk to your doctor about this so that you can get the diagnosis and the treatment plan and then recovery.
Exactly. And how harmful is it to just hold on to the belief it's all in my head? And of course it's not your fault if you've had that belief, because it's just a cultural belief. It's what's kind of promoted. But then you don't end up getting the help that you really need if you just assume, well, it's all on me to fix this.
Right. Right, exactly. So a few more. Other infections like yeast infections or bacterial vaginosis. These are things that might might cause you to experience pain because of itching or burning, that kind of thing. And another thing is, a lot of people with pelvic pain, if they're experiencing these symptoms, they assume it's a yeast infection, and oftentimes they're wrong. So try not to like treat yourself. Go get it checked out to make sure it's a yeast infection and not something else. So another thing, nerve issues is a big one. We've got 2 main nerves going to the pelvic region, and there's a lot of things that can actually affect nerves, that can irritate them, that could damage them. Things such as structural issues with your hips or your spine, trauma such as falling really hard on your pelvic bone,
tailbone?
your
Okay.
tailbone. Thank you. Yeah, like snowboarding or just slipping and falling.
That's a very specific example. If you
I've
snowboard.
I've known people to have serious damage to their
Really?
tailbone through things like snowboarding.
Wow.
So different sports, or just if you're accident prone, you could have damage to this nerve that could be creating issues for you. Childbirth can irritate or damage these nerves, and
Nerves.
so that can cause pain. And then also there are people that can have hypersensitive or an excess of nerve endings. Specifically, I believe it's in the vestibule of the vagina, but it's really interesting. Some people are born with that, an overproduction of nerves, and they know that because their belly button is also extremely sensitive to pain. So if you're someone where your belly button is extremely sensitive to pain, and you're
Wait,
having
this sounds like something really interesting. If your belly button is sensitive to pain, then you might also have an increase in nerves in your vestibule and
in your vestibule of your vagina. Yep, because it comes from like the same like fetal tissue essentially.
So interesting.
So
Everybody poke your belly button and
and see the response.
Yeah. Wow.
Yeah. So that might just be an indicator for you. So there is such a thing as having too many nerve endings.
Okay.
That's really interesting. Okay, next one, smegma. So there is something to be said for oils or dead skin cells creating a buildup, which can cause clitoral adhesions. So different parts of the clitoris adhesions to a cell, and causes pain because it's rubbing against what you would almost like sandy.
Oh.
So that does not feel good.
Yeah. Oh, ouch.
Yeah. So that might be something going on if you're experiencing like clitoral pain.
Clitoral pain. Okay.
And then allergies. Believe it or not, some people can be allergic to their partner's semen, or they might be allergic to things that they're coming into contact with that's causing irritation.
Something else to be mindful of. So allergies, it could be allergies to, did you just say your partner's semen? And I just I just blocked that out. Okay. I blanked out for a minute. Yeah, partner's semen. It could be a product you're using, something on a sex toy, a type of lubrication. Something you need to be careful of as well, performing oral. If your partner has eaten something or drank something that might be irritating or an allergen for you, like you need to be really mindful of that. That can cause pain and irritation as well, and inflammation, I would think.
Great point. Great point. So hopefully with this overview, you have more hope. You have hope that there's an answer. So now that you have that, let's discuss actually talking to your doctor about pain. Right? Something that can be scary for people, hard for people. Let's walk them through it.
Okay.
Right.
And I just want to say too, if we have anybody in the chat that has a question pop up or want to hear a little bit more about any of these potential causes, feel free. We'll do our best to answer any questions. Or if you just want to say hi, say hi.
Right. If you've experienced pelvic pain and you've been diagnosed and you have a cause and you feel okay to be vulnerable and share that too, we would love that.
Yeah. Yes. Yeah.
Love to hear your story.
We're doing our best to create a safe place for at least people on the internet here. I don't know how many safe places are left on the internet.
Yeah.
But to share and connect with each other and hear each other out, give each other feedback.
Yeah.
So, yeah. Sorry, Victoria. I just want to put that out there.
Don't be sorry at all. No, I love that. So when you call your doctor, if you're calling your doctor for a check-in about something, oftentimes a scheduler will only schedule you for like 15 minutes, just like a really quick checkup. And you're going to need more than that if you're talking about pain. We just talked about all these different causes, right? Do you think that they could go through all of this and do a thorough assessment in 15 minutes?
No. Nope.
No.
Shouldn't.
Shouldn't.
It doesn't seem ethical, so.
Shouldn't. Exactly. So when you call the scheduler, it's okay if you don't feel that comfortable disclosing that you're experiencing pain. If you can, that would be very helpful. But if not, at least ask for maybe an hour appointment stating that you have significant concerns, but you don't feel comfortable sharing that with them.
Right.
That's okay.
So the first thing is to really advocate for the additional time. You need to ask for more time. And so we're going to talk about all the things that you should prepare ahead of time right?
Yes.
Before this appointment. So first one, you need more time than 15 minutes.
Right. Yep. And if you can prepare yourself, like knowing anatomy a little bit, right? Like I just used the word earlier, vestibule, right? There are different parts, intricate parts of your vulva, right? Whether it's like the labia minora or the vestibule. Try to do a little research with diagrams and use a mirror and try to figure out like exactly where your pain is.
Yeah, it's a good idea.
That way you can better explain exactly the location of it. And if you can do research like such as through this or reading books such as When Sex Hurts, which we have in the link, the description box, we have a link so that you can bring more scientific information. You might be able to help direct that conversation in the right way as well.
I think so often we have to be our own advocate in the medical industry. I hear this time and time again from family, friends, clients, even in my own experience, like doing your own research. And of course, you're not a doctor, unless you are and you're listening to this, but you know, you're not a doctor. And so, you know, but you have to really advocate for your needs, I think, to be heard sometimes. I think it's just the system that we are working with here in our country, anyway, in the United States. It's
A lot of doctors too, I believe, they have a lot of patients and it's hard to provide the time that is necessary or the research that is necessary. Not all OBGYNs, believe it or not, are extensively trained in pain. Most aren't, is my understanding. And so it might help direct the conversation if you have more knowledge yourself to be like, based on this research, these are all my symptoms. This is lining up with this. Like, I really think we should look more into that.
Yeah. Which is it's a courageous thing to do, but a necessary one, right?
Right. And be as descriptive as possible. Think of all like the adjective words that fit your pelvic pain. Is it burning or stinging or stabbing, itching,
aching?
So do you have any more? Pressure.
Pressure.
Yeah. Is it radiating, right? Or is it like localized to a specific area? And try to use a pain scale, right? If you're going in and this is painful, make sure that they know that. Make sure they know that most of the time it's a 9. Or when there's penetration, there's a 9, but when there's touch, it's a 7, right? Like use the pain scale in these different areas.
And so spending some time with your own body and really practicing some attunement when you're feeling these sensations can help there. So you might have to almost like have a prep session with yourself. Like, okay, I'm really going to pay attention to what this pain feels like and make note of it. And that might be a little bit of a strange idea, but it could help you out in advocating for yourself, right?
Right, exactly. And then you need to talk about when, right? When you're experiencing this pain. Are you experiencing pelvic pain when you're sitting down? When you're experiencing penetration? When you're experiencing clitoral stimulation? When you're just wearing clothes? When your underwear is touching your vulva? Or if you're inserting a tampon? How long are you experiencing the pain for? During and after? Do you just experience the pain during initial penetration? Or do you experience the pain long after that?
Right, yes.
Right. Does it change with your menstrual cycle? More during or maybe in the luteal phase or a different phase of your cycle? Is it worse or better? Like when is your pain? It might help with
the hormone piece, right? Trying to understand, is there a hormone connection here? And like what kind of penetration are we talking about too? Like, right?
Right.
And what does that penetration look like? And is it, I think that can be a tricky thing to talk about, but just really important. It's relevant, right?
It is so relevant, right? Try to create a timeline. How long has this been going on for? Maybe you've been experiencing like a level 3 pain for as long as you can remember, and now all of a sudden it's a 9. Or maybe it just started happening in the last couple of weeks after you had that snowboarding accident.
Are there
Probably
times when
should
you
know, right?
Yeah, and like, are there times when you don't feel it too? And what might be different about those times? Are there different, like if we're talking about pain with penetration during sex, are there different positions that maybe are more or less
Yes.
painful for you that might give some more insight as to where the pain is happening and why it might
Yeah.
be happening?
Yep. The location of it.
Mm-hmm.
Exactly. Are you having other symptoms, right? Like make sure you're disclosing that to your doctor. Are you having itching? Are you having discharge? Um, are you experiencing symptoms around menopause, or are you experiencing bowel and bladder issues? Is that function normal?
Because that
That's
can be
another,
related, right, to the pelvic
yeah,
floor. That if you're like, well, every time I sneeze now, I notice I dribble a little, or I've had some accidents that are
exactly.
different for me, and that could be related to the muscles, right?
Exactly. That can be related, and also there are, obviously we didn't have time to get into all the causes, but there are bladder issues and bowel issues that can contribute to pelvic pain as well, like IBS, for example. So they might want to know that,
Yeah, or like, is there
what's going on.
inflammation in some of those areas that could be felt during penetration? I wonder.
Right, right. So make sure you're disclosing any other symptoms you've had, what treatments you've tried for all of this. Have you tried any, right? Like, did you think it was the yeast infection and you tried over the counter medication? Have you tried holistic approaches, thinking that might occur? Are you trying heating pads or cooling, or what have you done? And then also, go ahead. I saw you look. So.
We can wait. We can wait. We'll finish your thought and we can address our
Okay.
chatter here in a minute.
Okay. Bring your list of medications. Like we had talked about, some medications can affect lubrication, so bring that list. They might take a peek at that and be like, maybe we try adjusting this if we think that's the issue. And also, in terms of talking with your doctor, it can be really helpful to bring a friend. I know that this is like,
Such a vulnerable thing to talk about.
it is. Which might be why bringing a friend is helpful, right? Because you might be nervous, and so you might forget some of these symptoms or some of these things that you should touch upon. And this friend or a partner could be like, oh, you forgot to mention this, and they could just be that supportive person for you if you're comfortable sharing that with them.
Yeah. Well, we have a comment here from Marcus. Started following you since the ball busting video. I really like how you approach kink respectfully. Thank you so much. That means a lot. Thank you for that feedback.
Yeah, we're glad you're here.
Yeah,
Thank you for
thanks
joining.
for following.
I know that this topic is a bit different than that one, so
we're
we
all
appreciate
over
your
the map.
interest. Yeah, we are
with
all
our
over
topics.
the map.
Yeah. So, and if you have any suggestions or ideas for future topics, we would love feedback, and we'll absolutely do what we can to address other topics and answer any questions you might have. So, thanks for joining us tonight.
Yeah, happy to have you. All right, 2 more tips for talking with your doctor.
Okay.
Similar to bringing a friend, role play can actually be really helpful. Before you go to the doctor's office, you can use your therapist or you can use a friend, and you can just be like, I'm going to practice having this conversation with my doctor, just so I can get rid of some of that anxiety by exposing myself to this conversation prior to.
It sounds cheesy, hokey therapy stuff.
It so
I
does.
know it does. And yet it really does help. It really does.
Yeah.
Like, do a little, even, you could even do it with yourself in the mirror. I mean, full transparency, some of the introductions I've done in some of our live streams, I have practiced out loud. I must sound like such a weirdo. Out loud on tonight's pleasure program. I'm practicing it out loud, and it's something about really actually doing it. And, you could practice in a mirror or not, just saying the words out loud and rehearsing it and getting comfortable with it can really help, reduce some anxiety and prepare you for something that is new and different that you haven't done before.
Yeah, absolutely. I love that you shared that, because it can help across the board.
Maybe I'll get a teleprompter. That might be a little bit easier, but example here.
Make sure you ask your doctor if they have experience with pelvic pain and what that looks like, because like we said, they may not. They may have a limited scope of practice with pain. And so then you might be able to ask them if they're willing to consult with a local specialist around this, or if they're willing to refer you to a specialist, that would be helpful to know.
Yeah, for sure.
And so once you have this conversation too, just to give you a little like what might this look like after, they might do some blood tests to check your hormone levels. They'll probably do an external and an internal exam, right? Look for any skin issues. They'll likely use a speculum to look inside. If that makes you anxious because you're experiencing pain, so valid, so normal.
Yeah, and it can be painful if you're, right? Anything being inserted, any kind of penetration, even with a speculum, can be painful.
Right. So they might do that. You can ask for a mirror to see what they're doing, if that helps. You can ask for a pediatric speculum so that it's smaller, so hopefully you'll experience less pain. Trying to think if there was anything else. Is there anything else that you could think? Oh, and you can insert a speculum yourself. If you're worried about that. They may not do an internal exam.
Yeah.
Yeah.
Wow. Like, let me do it. Right? Show me how this thing works and I'll do it. Right?
Right. So that might help. Or they may not even do an internal exam depending on your pain. They may do what's called like a Q-tip test, where they feel around to see if that's causing pain, which might be related to having too many nerve endings. So that might be what that looks like, just to prep you on what that might look and feel like. So if you're dismissed by your doctor, right, like if they're invalidating, like, so sorry, but do your best not to give up, right?
Yeah.
Sometimes it takes 3 or more doctors, unfortunately, for people.
Yes.
But we can get you there, right? We have to keep advocating. It's so frustrating, but don't give up. It's not in your head, right? Don't let the dismissal get to you. Like, lean into therapists, right? Lean into your supports and keep advocating.
Yeah, you might need some support through that, especially if you're like, oh, I got to do this again. I have to see another specialist. I have to explain all of this again. It can just be so overwhelming, and having a good support system through that, I think, is really important.
Yeah.
Okay.
So, yeah, go ahead.
We've got another couple comments here. Should we pause?
Yeah, we can pause.
Marcus is suggesting maybe something about erotic hypnosis would be a nice future topic. Well, it's very interesting. You can definitely look into that.
Yeah.
Thank you for that suggestion.
Thank you for the idea.
Okay, Mary, I love the suggestion of practicing and thinking about the questions beforehand. This live cast is so informative, and I love that you give strategies to scenarios we can relate to. That's awesome. Thank you, Mary.
Yeah, thank you, Mary. Thanks for tuning in.
I'm glad you're finding it helpful.
Have you here. Yeah. Okay, so we kind of covered some of the causes. We covered how to talk to your doctor. We should cover, hopefully once you have a diagnosis from talking to your doctor and a treatment plan, in the meantime, right, how do we cope with this? And then how do we maintain our relationships in it?
Okay.
Right. So let's start with coping with sexual pain. This is really hard, right? Like, pain, when you're experiencing sexual pain, it impacts so much of yourself, like your identity, how you feel about your body and your life and your relationships, right?
This is where we come into play, I think, as sex therapists, is the difficult part, the challenging part, how you're coping with this, how it's impacting your life, how you feel about yourself and your body, how you feel about the status of your relationship if you're in one. And I think that there's a lot there, right? And also supporting somebody through that whole process of trying to get help and get the medical part of this treated is where we can offer some support.
Yeah, right. So it does impact a lot of people's self-esteem, right? It impacts how they feel about their body. So when you can, which I know can be really hard, try to practice some gratitude and like refocusing to other aspects of yourself and your body that you appreciate, right? Like, try to have these positive affirmations. Try to focus on perspective. We talk a lot about power and perspective, right?
Yes, yeah, the gratitude there. And this is very similar strategy, just with embodiment. And if you're experiencing a body image issue, gratitude is often really helpful, right? Like, what are the things your body is doing for you that you can appreciate?
Right.
Rather than focusing on where you feel like it's betraying you or not functioning for you the way you wish it were.
Right. Exactly. So I know that that's really hard, but that's tip number one, because perspective is so powerful, right? The worse you feel about yourself and the more that you're stuck in this negative perspective, the more tension and stress you're going to have. And tension and stress is also highly related to pain. Is that the reason for your pain? No, but it does contribute to it.
Right. It's going to worsen that. This kind of reminds me of our video on erectile dysfunction.
Yes,
with
absolutely.
like the overthinking and hyperfixating and feeling so anxious and worried about, am I going to be hard? Am I going to be hard enough? How hard,
Exactly.
that inadvertently causes more problems because you really need to be relaxed to have a full erection. This reminds me of that, right? Like this similar kind of dynamic with the mind and body connection. If you're stressed and overthinking it and you're just setting all this negative energy and having all these negative thoughts about yourself, is that going to help your cause of some self-acceptance and relaxation and being kind of you can be gentle with yourself physically and emotionally, right?
Right. Absolutely. It really does make a big difference, even if you don't realize it, right?
We have a question here from Soprano. Is there a difference between sensations that are physically painful and sensations that are physically uncomfortable during sex? That's a good question.
Well, so that is a great question. So pain is never good, right? Painful sensations are never good in sex unless you are...
Unless you're in the kink community, we have some kink representatives here.
Exactly. Unless
it's a wanted pain and a welcomed pain.
If it's wanted pain, that's different. If it's unwanted, unprompted pain, that's not good sensation. Uncomfortable sensation, that can happen, right? Like with different positions and things like that. That's where I go. Where do you go?
It kind of makes me think of that pain scale, that if you're at like a 0, well, a 0 would be no pain, a 1, a 2, maybe a 3, like you might be registering that as, ooh, this is uncomfortable. I'm not like at an ouch, oof, that hurts place, but like something about this it's not feeling pleasurable. And it's not like a desired kind of discomfort and that might mean there might be some simple adjustments you could make.
Right, like lubrication or changing the position, having more foreplay time, right? Like,
that's where my mind goes, that the uncomfortable part might mean that you could make some adjustments there in the moment, and you should honor that feeling, I think, and pay attention to it rather than be like, well, it's just a little bit uncomfortable. Power through.
Right, we're here to enhance pleasure, not just like get through it, right? Like we don't want that to be the mentality.
Yeah, and so that might be where maybe some communication comes to play, where you say, "Ooh, something feels a little bit off. Let's pause for a second and try a couple of changes and see if that helps."
Yes.
I hope that answers your question, Soprano.
Yeah. Okay, so next tip for coping with sexual pain: relaxation exercises, right? Like we said, tension is related to more pain. So the more that you can relax inside the bedroom and outside the bedroom, the better. Like relaxing both ways. Go ahead.
I'm going to take this in a weird direction. Have you heard that like the fear receptors in the brain are like kind of near the pain, where we process pain, so that like fear and pain kind of, that's why if you're more fearful, pain can feel stronger? Or am I just like, am I just throwing a myth out there?
I'm not doubting it, but I haven't heard it.
Like, you know how they say like your sense of smell is so strongly associated with memory, because your olfactory bulb, where you process your sense of smell, is just literally anatomically right next to the part of the brain that processes memory and stores memories. And that's why that sense, you all know what I'm saying? Yeah. Thank you. Is the strongest sensation associated with memory. And so I've kind of wondered, or I feel like I've heard this, but I mean, feel free to, if anyone wants to Google and let us know in the chat, please. like if where you process fear, perhaps the amygdala maybe, is that near where we identify pain, a pain response.
Good question.
I don't know. Just decided
We'll have to do some research.
just decided to throw that out there. It sounds very smart and like it makes sense, but it could totally be bogus.
Could be true though. So, what are your favorite relaxation exercises?
You're like, can we please get this back on track?
This back on track.
Okay, my favorite, and I do this even when I'm working with clients, because sometimes when we are working with clients, they might have a very heavy session. Maybe they're sharing a lot of very heavy traumatic, parts of themselves and their experience. And so we feel that, right? Like sometimes I feel like, whew, like this is feeling a lot. Exhaling is the number one way I can, no one knows you're really doing it. Not that it needs to be a secret, but like just having an extended exhale, just like sitting there and really just like letting all the air out. You can do it through your nose even. I always say you should do it through your mouth. But when in a pinch, have a nice long exhale. It's the exhale that relaxes us. Right? Because when we think about being stressed, we're like inhaling, we're like holding the air in, and we're like breathing very shallow in a shallow way, right? And your chest feels kind of tight. So just nice long exhale.
That's actually my favorite as well.
I
people
said
are
it
all
first.
about these all about these like box breathing and all these like
it gets really
7,
it's
5,
real
3
fancy.
things, and I'm like, I don't want to count really, but as long as you're exhaling longer than you're inhaling, you're doing a great job at regulating your nervous system.
Yeah.
Right?
Yeah.
The only thing I would add to that is when you do inhale, try to breathe in through your belly, right? Not breathing shallow into your chest like you were talking about. We do breathe really shallowly. So if you can breathe into your belly, that also really helps your nervous system to relax.
And an easy way to remember how to do that is imagine your stomach is like a balloon, right? When you breathe in, it should extend out, and when you breathe out, it should deflate. And that's how you know you're breathing from your diaphragm and not like in that shallow way up in your lungs.
Yes, exactly. So beyond relaxation exercises, it's really important to try, when you are trying to experience some sort of sexual contact, either with yourself, just with yourself, solo sex, or with your partner, create a sexy environment, right? Focus on sexually arousing thoughts, fantasy, like get your mindset into it, right? Really try to be mindful about where your brain is at, right? You're not going to be relaxed if you're thinking about how it might be painful.
Right. And we have a past live stream on solo sex, also known as masturbation. Check that out if you want some more, insight into how to go about having a great solo sex experience. And we've covered, other live streams have covered how to really create that sexy mindset and environment. A fizzle to sizzle is one of we have some fun titles. From Fizzle to Sizzle is one, and then the other one is 8 Tips to Your Best Sex Life.
The Magnificent Sex one.
Yes, where we cover that book. So check those out. If you are listening in and you are struggling, I really think that you'll find some really useful strategies from those videos that you can incorporate to really help prepare you to get in that mental state and physical state for optimal sex, given the pain that you're experiencing, really trying to make the most of the sexual experience in other ways too, which I'm sure we're going to talk about.
Yeah.
Also, if anyone in the chat has a favorite relaxation strategy that they've tried, whether it's related to sex or otherwise, so we'd love to hear more ideas too.
Yeah. So practice day to day being in a pleasure-focused state, right? We've talked before about having a negativity bias, right? Try to focus on what's pleasurable to you, not necessarily sexually, just in general, right? And that will hopefully help translate sexually to being pleasure focused as well. Day to day, practice that. Try not to have expectations of yourself, right? Like, don't have shoulds. You should be doing this or you should be doing that. Just explore your body with curiosity, right? Through solo sex, just explore it, see what might feel pleasurable, right? Rather than painful. Do not tough out pain.
No.
If something is feeling painful, stop and do something differently, right? Like, we don't want to reinforce this association that there's pain with this.
Right. And like we've talked about this in other shows, there is, penetration is not the end all be all.
Exactly.
Right? Like there's oral, there's other holes in your body that you can explore. There's
exactly.
If external stimulation is not painful, but internal is, you can focus on external stimulation. So just, I think I wouldn't even suggest, if you're struggling with pain with penetration, like I wouldn't attempt that every time you have sex with a partner. Like have a penetration-free sexual experience. Like you owe that to yourself just to also have
exactly
a really like stress-free, no pressure sex with your partner. And I think that is just as important as being like, okay, let's maybe try some relaxation and we can attempt a little bit of penetration and see how that goes, and be willing to just like be very gentle and easy with yourself around that, and have alternative ways to have fun and experience pleasure is super important.
Right. I completely agree. And be flexible. If yesterday, oral was feeling great and it wasn't painful, but yet today for some reason oral is painful, be flexible, right? Change that up, right? What worked for your body yesterday may not work today. You said in our Magnificent Sex Stream, bodies have moods, right? And that's okay.
Bodies do have moods.
So just be flexible with that. And it's really common for people who experience pelvic pain to engage in this catastrophic thinking. Like, I'm never going to have a diagnosis. I'm never going to have pleasurable sex again. This is never going to get better. And that creates tension in your body, right? That creates anxious feelings, which creates tension, which creates more pain.
Right.
So really try to challenge that way of thinking. Try to remain hopeful, right? Try to read success stories. Try to listen to this where there are these causes that we can find, right? Like read different books. Like try to have a more positive mindset, even though it's really, really hard.
And I think that comes down to also challenging our beliefs around sex too. Like, and how could you not feel like this is the worst thing that could happen to you and the most devastating thing when all we ever see is penetrative sex where, the woman's just orgasmic in moments and, like the guy's massive and everyone's having wild fun in a matter of minutes. Like there's so much wrong with that. And there's so much that is not real about that. But of course, if you're like, I can't even tolerate like, any penetration at this point, or it's just so painful. Like you feel like you have failed as a sexual being when all we've ever been taught is this cookie cutter approach. So I think challenging your beliefs around sex is a really big part of liberating yourself to be open to alternative ways of being sexual and having pleasure and enjoying a happy and healthy sex life. It's not to say you shouldn't treat this issue, but it doesn't have to like be the sole focus of your pleasure, right?
Right. I agree. I think the last thing I'll say about this area is the less stress you can have in your life, the more that's going to be supportive of you in pleasure, in recovery. So find ways to reduce your stress in all aspects of your life. What do you need? Do you need more exercise? Do you need more sleep? Do you need more support? Like more time with friends, more fun, more meditation?
A different job.
Yeah,
if you can,
Right.
A hobby.
Right. Like a dog? Like, what do you need to reduce some stress?
A cat.
Right, exactly.
A bird.
Okay. So, anything else for you on that topic?
I just wanted to make note of what we talked about in our last live stream when we talked about tips to your best sex life. We talked about how the the book that we reviewed there covered individuals who claim to have magnificent sex lives and what's different about them. And a lot of them identified that they didn't have their best sex lives until they experienced a problem of some sort, like a chronic illness or an injury that required them to get creative in their sex life, and that's when they started having great sex. And
I
so
love that point.
I just want to like reiterate that. I know we're talking about something a little bit different here, but I mean, chronic pelvic pain it's a real issue, and you can use that while you're trying to get treatment as an opportunity to get very creative in your sex life and explore and challenge yourself to break free from that pressure and expectation to just struggle through the pain, right?
I love that note. Yeah. And relationships can really struggle. Let's talk about how to maintain connection and intimacy throughout experiencing sexual pain, right? This can create some disconnection because, partners can feel rejected. If their partner is avoiding sex because of pain, they can feel guilty if they're causing pain. So overall, it can create some issues, but it doesn't have to, right? Biggest thing you already touched upon, right? Like we have to shift the mindset of what is sex. Sex doesn't have to be penetrative. Right? Like you said that beautifully. It's not the be all end all. You just have to be curious and explore pleasure together, right?
Yeah. And I think if you're a partner of somebody who's experiencing pelvic pain, you get to be understanding and mindful, not place any pressure. Certainly be respectful of any acute pain your partner's feeling, and stop and be like, roll with it, like adjust, be like, okay, let's do something else and let's try something else. And if you get super distraught and in your head and feel super rejected, like it's just adding like insult to injury, right? Like it's just going to snowball and be such a negative. You want to keep sexy time sacred. You really want to try to keep negativity and like, big reactions out of that situation, because for the same reason we've been talking about, it gets in your head and then you start overthinking things, then your body starts having a very anxious response for both partners. And that's just, then you have to really work through that. So really try to regulate your emotions and be open-minded and curious and be flexible.
Yeah, I completely agree. Adding pressure or having a negative reaction is going to perpetuate the issue, right?
Absolutely.
If you have this negative reaction of like, oh my God, again, then your partner is going to have anxiety the next time you go to initiate, right?
Not only am I in pain, but you're going to be upset. And
and then they're going to feel more pain from that tension, from that anxiety. So your reaction is huge. We talked about this, I believe, in our penis problems.
Yes.
Right? Like partners' reactions are huge. They have a significant impact on performance, on anxiety, everything, right?
Right.
So focus on other forms of touch, right? Focus on other forms of affection. At one point in your life, kissing was probably the main event.
Oh,
why
do you remember those days?
Why can't that be the case again every once in a while, right? Like, why can't kissing be the main event?
You know what? I challenge everybody listening right now. Your next sexual encounter, let kissing be the main event, and just enjoy that. Let it bring you back.
Right. Massage, whatever, like prioritize other forms of touch, right? And it's really important to communicate through all of this. We have a whole stream on communication around sex and having better sex. And so I would encourage people to check that out, to learn how to validate and empathize and be a good communicator around this type of thing, which can be really hard.
Yeah, it takes practice, skill.
It does.
Trial and error. You're not going to get it perfect. You're going to mess up. You're going to say, wish you had said things a little differently, but you keep trying, you do your research, and you'll get better at it.
Right, exactly. Focus on strengthening other areas of your relationship, right? Maybe your relationship could use some work on the companionship, on having fun together and friendship, or building trust, right?
Yeah,
Maybe
sex
you work
doesn't
on
have to
those.
be in the front
Yeah.
seat, right? It doesn't, we definitely go through seasons of life where like it's not the most important thing in your relationship, and that's okay.
Right. Right, exactly. So just focus on strengthening all these other areas so these are all strong as you work through this recovery, right? Be flexible, right? Just like we're asking someone coping with sexual pain to be flexible as a couple, right? Maybe massage works really well one night, maybe oral works really well another night, right? Maybe mutual masturbation works well.
Yeah, if you feel like if you're in control of like the sensation that you do better, mutual masturbation is a great idea.
Yeah, and then maybe also you're teaching your partner what feels pleasurable versus painful.
Yeah, demonstrating.
Yeah,
Again, it can be a really vulnerable thing, but you know, great things come from our willingness to be vulnerable with each other.
exactly. Exactly. So overall, like pain affects relationships less when there is good communication and there is flexibility and there are expressions of love, right? So focus on those things,
Yeah.
right? And then your relationship has much greater chance of being intimate and connected throughout
Right.
this.
Right. And it will help the treatment process along too.
Right. So, in summary, hopefully, right? We've provided some hope. You know that it's not in your head. You know that there are all sorts of different causes in all these different areas. So you have somewhat of a roadmap to start, right? You know to look into more resources such as When Sex Hurts, right? Looking into gut diagrams to help you better communicate about your pain to your doctor. We've talked about strategies to talk to your doctor. We've talked about ways to cope with this in the meantime and ways to keep your relationship strong in the meantime. Okay. We'll leave you guys with a question. Can you share your most favorite relaxation exercise so that you can help other people relax and reduce tension and hopefully overall reduce some sexual pain?
Yes, please leave us your ideas in the comments. We'd love to get some like a brainstorm session going on here and help each other out. Awesome.
Okay. Thank you for listening and commenting and tuning in.
Yes, thank you for everybody who participated in our chat tonight, for the lovely feedback and the questions and suggestions. It means a lot. We will be back in, I'm already like, what's our schedule? We'll be back when we're back. Just keep an eye out. We usually post when we're going to be going live. Usually it's on a Wednesday at 8:30. And then we have our other shorter videos, our pleasure program quickies. We've been answering viewer questions, so please leave us a comment on any of our videos. We do keep track of all of them. If you have a question you'd like us to explore in a future video, we are willing and happy to do so if we feel qualified to answer them. So, okay. Thank you, everybody. Have a good rest